Good afternoon. My name is Dr. Winston McQueen, and today we're going to talk about how to approach the Step 2 CS. I'm a resident physician in Manatee Medical Center, Puerto Rico. So remember, when you talk about the Step 2 CS, you have to remember this exam is about organization. So the first thing you have to remember is you have to organize yourself before you get into the room. So the three pieces of information before you get into the room are the patient name. You have to remember patient name. The other one, the chief complaint, the most important one, and then the vital signs. After you get this part of the information, before you get into the room, three things you have to remember, okay? I wanna say that this is the mnemonic I use before I get into the room. So entering the room, you have to introduce yourself, you have to present yourself as a physician. And then you have to grade the patient, have to say, hello, I'm Dr. McQueen and I'm going to be your physician today. The other one is offering a handshake. So you have to offer a handshake, then you have to drop the patient, and then this is the more important one, ask the question. And the question has to be an open-ended question. That means, tell me about your symptom. So, okay, so then you have to start asking the patient, this is the mnemonic that I use. Okay, this is the mnemonic that I use when I talk about history of present illness. Okay, for example, if the patient have chest pain, this is just an example. You have to ask where the pain is located. So this one goes for, can you tell me the intensity of the pain from 0 to 10? For example, 10 being the worst pain of your life. How do you rate the pain? This is about the quality of the pain. Can you describe the pain for me? This is the onset. Is this pain acute? Is this pain chronic? And this one stands for radiation. So can you tell me where the pain goes? Or does the pain travel to another place? This is about aggravating factor. For example, what made the pain worse? And this is about alleviating factor. What made the pain better? And this is about the associated symptoms. Okay? That is the most important thing to remember. And before you start talking about the past medical history, you have to make a transition. And this is the other mnemonic that I use for this one. Like I said, it's all about organization. So before you start asking about history or past medical history, okay, the most important thing is about making the transition. You have to mention the patient you're going to start talking about the past medical history. Like for example, Mr. Brown, I would like to ask you about your past, and the patient will say, go ahead. So remember, the first thing I want you to remember when you talk about past medical history is all about organization, like I said. Okay, this stands for past medical history. You can ask the patient, tell me about, do you have any other condition? Okay, this stands for allergies. Okay. So do you have any food allergies? Like for example, do you have any drug allergies? Do you have any animal allergies? This is about medication. You have to ask the patient if the patient is taking any medication at the moment. And this is about hospitalization. Okay? This is the mnemonic that I use. HIT. Okay? This stands for hospitalization. This stands for immunization or any ill content. This is about travel, recent travel, and trauma. This is about surgery, past surgery history. So remember, this is about the review system. And the three important systems that I like to review are the GI one, okay? The GI system, urinary system, and the sleep. The patient is sleeping well. Remember, sometimes it's important to ask about family history, okay? This is stands for OBG. You have to ask about the how many pregnancies that the patient has, how many kids that the patient has, and the last menstrual period. Okay, and this is about social history. The one that I like about this one, this is this mnemonic. Okay, this is about tobacco use, alcohol use, recreational drugs, diet, exercise, work, and who does the patient live with. and this is about sexual history. Okay? You can ask about if the patient is sexually active, or the patient is, how many partners that the patient have if you suspect any sexual transmitted disease. And remember, this is about organization. And before you finish the encounter, remember you have to wash your hand and do a physical exam. Then you have to paraphrase about everything you get. Like for example, you have to say the patient has chest pain. You have to make a small little summary about the chest pain. Then you have to give the patient information. This stands for giving patient information. And then you have to tell the patient what you're going to do. And this stands for telling what the patient is going to do. Just imagine the patient smoke. This stands for counseling. You have to tell the patient that smoking or drinking can be dangerous for them, so you have to advise them to quit. And this is about asking if the patient has any question. And the last thing is saying goodbye. So, like I said, the Step 2 CS is about organization. If you organize yourself, you are going to do just fine. It's like learning how to dance the day of the exam. Thank you very much. I hope you enjoyed the video.